gloves for the crystal tip or the diamond tip, right?
I always put on gloves, especially if there's acne in the area and you accidentally rupture, you're gonna run into blood exposure. So.
Okay.
Need a pair?
Yes, and also you guys will need pairs as well, so maybe just bring in the boxes.
Thanks for the free stuff. You're welcome.
Pushing towards the forehead.
It's not like microneedle, like you pick it up every single time.
Mm-hmm.
Whenever I get out these repair machines, I like to just get a Ghostbuster and give them a turn light down because they get passed around a lot in between whenever someone uses them and the next person.
Yeah, binder.
So I'll, onto a rag, I'll just like wipe down the touching surfaces and then go into the handpiece and the hose and just roll that down so it's fresh and clean right beforehand. And it lives in this box, which lives on the radio frequency cards. So it's always on the bottom there. If you can't find it, then that usually means left over using it in their hands. And you can go, just wait for them to be done. I'll go ahead and steal it from you. Inside here is a couple of
So
things
only
that
under
you
the
will
outer
need
downwards?
in order to
Mhm.
use this.
I mean, once you get closer to the eye area, yeah, move
You
downward.
have
But if you're
your
down in the lower
actual
cheek, whatever's
diamond tip
easiest for you.
pieces of different sizes that you can choose from. And then you also have filters, which are really small. You're gonna put the filter into the piece itself. As far as which size to go for, these bigger ones are nice if you're gonna be doing some kind of exfoliation.
No, like sideways from here?
Surface area,
Mhm.
but I'm pretty much always gonna go for
You go down,
one of these.
so that you're not going in your nostril.
Usually
you're going
this like
sideways,
rounded
go
middle size is my go-to.
This way.
This little tiny guy, these little tiny guys, especially this teensy cute one,
And you
is
also
really
work
good at
downward.
hitting the areas around the nose. So I recommend once you guys get to the nose that you actually stop, take off whatever you're using on the face, and then put them on the nose. You can send out like your two pieces on your SMA and just have it ready to go when your client shows up. And the little filter will just drop right into the piece there, and you'll have to kind of scooch it around so that it lays flat.
Bailey, what if we I have a question, Bailey? Teacher Bailey, what if we run out of
Better view.
filters? What can we use instead?
If we're out of filters, first you should tell someone, like a teacher, because we have to hire a little more. But we can use a 2x2 or 4x4. Do you have an extra one? Okay. Yeah, you can literally just open up the 2x2 or 4x4, lay it on, and then screw that on top of it, and then that becomes a filter. Easy enough. There you go. You will plug your machine in. You will turn it on. The button for turning it on is on the back. It's red. The hose for this is not super long, so you'll have to get an SMA, and you'll have to make sure it's pretty close to the phone. My gloves. We won't squeeze them into a video.
Oh, I didn't know you were large. Sorry.
My hands are deceptively large. Well, I don't know. I feel like they're kind of proportionate, but when you really get to look at them.
Well, when you do that.
Yeah.
Yeah.
I like big.
If you need a lot, then you can
It
fits
fits
so
perfectly.
well.
I guess I feel like a large is like perfect because it doesn't. I have sensory issues, guys. Okay. Lay off. You should see my.
We're trying to help you feel better about your kids.
Thank you.
Not as big as you thought.
We're on. Turning it to the right is gonna make the suction increase, and you'll be able to much so that you're gonna be causing discomfort and bruising to their face. So I feel like this is pretty good, but also it might feel a little different to your client. So like, we're gonna be practicing on the back here, but your back is not gonna be as sensitive as your face. So it's important that once you're actually working on the face, you ask if the section's comfortable. Most people are not gonna say anything on their own unless you ask them if they don't know any better. They probably think, oh, this hurts, this is supposed to
Your skin
hurt.
still feel okay?
So whenever you guys practice, I want you to practice holding taut. It doesn't do you a ton of good if your fingers are already spread out and you just set those down and then go in. I want you guys to actually use a pinching motion to pull the skin taut so that the skin is actually tight and go in. And just like Jose mentioned, we're not going to be pushing at all with this handpiece. We are just gliding it across the skin. Section, dissection. And obviously we don't have mapping for the back because but
Trinity, Shelby was looking
this
for
to
you.
me feels like the perfect amount of section. Is this comfortable for you? Okay. So if we were working on the face and we came to blemish like so, we are going to be working around this. We do not want to go over this and then potentially suck up some of the juices and spread them everywhere. Yeah, and then the benefit of going like the whole, we'll talk in reverse the face. Going the whole face with your first pass